Welcome back, everyone, to our classroom called the College of Glycation. Once again, my name is Paul Reynolds. I'm a biomedical scientist and professor of cell biology. If you've been following along, you know that we've been peeling back the layers on how our metabolism shapes everything from energy levels to chronic diseases. Today, we're building on those earlier episodes where we talked about glycation. You'll remember that's the sneaky process where sugars stick to proteins and fats in our bodies, creating advanced glycation end products or AGEs. This episode is all about glycation and how it compromises our bones, turning what should be a sturdy scaffolding into something much more fragile than you'd like. We'll explore the links to conditions like osteoporosis and osteoarthritis, the role of aging, and yes, once again, insulin resistance, because as you know, that's often at the heart of these metabolic messes. Stick around because by the end of this episode, you'll have strategies to fight back and keep your skeleton strong. So let's start with a quick refresher on glycation, because understanding this foundation is key to grasping why our bones ultimately pay the price. Glycation happens when glucose or other similar sugars in our bloodstream react with proteins, lipids or fats, or nucleic acids. And this process occurs without any enzyme involved. It's a non-enzymatic, spontaneous, and irreversible process. I've used this example before, but I like to think about an example of caramelizing onions. But instead of adding flavor to the process, it will gum up the process, making proteins or other molecules work much less effectively. The end result is, as I've mentioned at the start, AGEs will accrue. AGEs are cross-linked dysfunctional molecules that will accumulate over time. In previous episodes, we discussed how AGEs contribute to vascular stiffness and kidney issues, among other items as well. But today we're zeroing in, as I've mentioned, on the bones, because AGEs don't just sit there, they alter protein structures in the bones and other connective tissues. They'll trigger inflammation, further compromising that particular mess of molecules, and they'll disrupt cellular signaling. Now, these items were shown among other mechanisms in a review published in 2022. The authors were led by primary author Zhang, and he and colleagues describe how AGEs accumulate in bone tissue and over time reduce bone strength and impact structure and homeostasis, especially in individuals with diabetes, where high blood sugar will accelerate bone loss and bone compromise. So let's dive into how this plays out in our bones specifically. But first, a bit on the basics of bones themselves, because appreciating their complexity makes the damage from glycation hit much harder. Bones aren't just inert rocks or stabilizing structures. They are living, dynamic tissues that support us, protect our organs, stores minerals, and even produces life-saving blood cells. At the molecular level, bones are a composite material. About 70% of bones is inorganic minerals, and the most common variety is hydroxyapatite, which is a crystalline form of calcium phosphate, a salt, that provides hardness and compressive strength. The other 30% is made up of organic components, primarily type 1 collagen fibers. Those are the most robust, tensile strength providing molecules that afford some flexibility. Other key molecules include non-collagenous proteins. One example of is osteocalcin, and that helps regulate bone mineralization and growth factors that guide remodeling. Bone formation, or ossification as it's often called, happens in two main ways. The first one is called intramembranous ossification. And in this case, mesenchyme cells directly turn into bones. Think about flat bones like in the skull or the cranium. The other type of bone formation is called endochondral ossification. And in this case, a cartilage template is first formed and it eventually becomes replaced by bone through a process that involves chondrocytes first, those are cartilage cells, that proliferate, hypertrophy, and then become invaded by blood vessels. The last step is the deposition or insertion of osteoblasts. Those are the bone building cells that lay down the matrix. Osteoblasts are the builders. They secrete collagen, they make minerals available, and eventually will build the bone. Osteoclasts, however, are the opposite type of cell. Osteoclasts are the removers. They break down old bone. And these two cell types interplay with each other, osteoblasts that build bone and osteoclasts that destroy bone. So the ratio between both will manage the appropriate level of growth and remodeling. At the end, we might also consider osteocytes. These are the mature cells in the bone that have already done their work. They're essentially retired cells that become embedded in the matrix. These used to be osteoblasts that build bone, but now they're just kind of chilling out. They can sense mechanical stress and orchestrate the whole show. In fact, they might come out of retirement and become osteoblasts once again when there's significant damage like fractures, etc. Now, this constant turnover keeps bones adaptable. The interplay between osteoblasts and osteoclasts keep bones resilient and they adapt. But it's precisely this matrix, especially the collagen, that glycation will target head on. When glycation happens, they form crosslinks that stiffen up these collagens, making them much less resistant. Imagine your bone matrix as a trampoline net. Normally it flexes and absorbs impacts, but ages turn it into a rigid board that cracks under pressure. Research from a team in 2002, over 20 years ago, demonstrated this perfectly. They found that AGE's crosslinks will increase the stiffness of collagen in human articular cartilage. That's the cartilage found between joints. And that cartilage is a precursor to bone and joint problems. And this stiffening will definitely worsen over age. Now, it's not just the stiffness that glycation will impair. The bone's extracellular matrix is also impacted. And when the matrix molecules are glycated, we can arrive at what's considered progressive matrix loss. This is where matrix degrades over time, losing its ability to support mineralization and cell activity. So what's the result with this progressive matrix loss? Well, weaker bones that cannot repair themselves effectively is the key outcome. This progressive loss ties directly into major bone wasting diseases, starting with osteoporosis. Osteoporosis is essentially bone thinning, where density drops and fragility skyrockets, leading to fractures from even the most minor falls. Glycation exacerbates or worsens osteoporosis because it promotes inflammation in the area and inhibits bone formation while boosting its breakdown. In 2014, there was a study published by Sanguinetti and friends, and they highlighted how AGEs act as pro-inflammatory agents in osteoporotic patients, accelerating the progression of this disease. It's a vicious cycle. AGEs bind to receptors on bone cells, receptors called RAGE, and it ramps up oxidative stress, that tips the balance toward resorption or bone loss, the process where old bone is eaten away without adequate replacement. Then there's osteoarthritis, which affects the joints but spills over into bone health as well. In this case, glycation stiffens cartilage, as we saw earlier, leading to wear and tear that erodes underlying bone. That is, again, the hallmark of bone-on-bone osteoarthritis. DeGroot and colleagues in 2004 pinned aging as a risk factor for osteoarthritis precisely because age accumulation, showing how these end products disrupt cartilage turnover and makes joints much more prone to degeneration. Now, there are other bone wasting conditions. You might have heard of Paget's disease or even cancer-related bone loss. All of these are also worsened by glycation though the evidence is strongest for these big two, osteoarthritis and osteoporosis. But I hope that you'll see that there is a common thread to all of this discussion. Glycation doesn't just weaken bones, it makes them much more susceptible to everyday stresses, turning a stumble potentially into a hospital visit. We will all experience wear and tear as we age, but the susceptibility to this severe damage can be worsened by glycation. Now, aging amplifies all of this, and it's no coincidence. Glycation is intimately linked with getting older. As we age, our bodies naturally accumulate more ages because glucose metabolism slows and the clearance mechanisms begin to falter. This leads to bone loss as a natural consequence. And you've all heard of this. As you get older, your bone density, muscle mass, lean mass wanes. But let's be clear, it's not inevitable, it is metabolic. Bone fragility increases because ages impair the osteoblasts, the bone builders, and exacerbates or activates osteoclasts. Those are the bone removers. In this case, disrupting the delicate remodeling dance that should be maintained by both cell types. Sroga and colleagues in 2015 worked on insulin-like growth factor 1, or IGF-1, and they found that glycation had a clear role. What they did was they proposed that declining IGF-1 with age exposes bones to more glycation damage, reducing fracture resistance. Similarly, Dr. Wang and colleagues just a few years ago in 2013 offered a review that focused on how advanced glycation and glycoxidation end products build up in bone, explaining the heightened fragility in aging and conditions like osteoporosis. For review, glycation is where sugars attach to proteins and other molecules. Glycoxidation is where age products or glycation products become oxidized, essentially similar in effects to the ages generally. Picture your bones as an old bridge. Over decades, rust or ages weakens the supports, and without maintenance, it may crumble. Aging isn't just time passing, it is the accumulation of glycation products that stack the deck against us. Of course, we can't talk about glycation without addressing insulin resistance. It is the upstream villain in so many of these stories. Insulin resistance is when your cells stop responding properly to insulin, the hormone that should shuttle glucose into cells for energy. Now, why is insulin resistance a problem? Well, it leads to chronically high blood sugar. Remember, if you cannot effectively shuttle sugar into cells, that sugar will persist in the bloodstream. And that persistently high level of sugar will fuel glycation, like throwing gas on a fire, as we've mentioned previously. Uncontrolled glucose means more sugars that are floating around to tag proteins and in the process create ages that will infiltrate bones and cause loss and fragility. In type 2 diabetes, which is a hallmark of severe insulin resistance, this process is amplified. Bones become denser on scans, but paradoxically more brittle due to poor quality. Eckert and his team in 2020 published research that showed accelerate osteocyte senescence, basically bone cells that age prematurely in mice with type 2 diabetes. And this research team linked it directly to skeletal fragility. Osteocytes are the conductors of bone remodeling. When excessive growth is needed, these cells can transition and become osteoblasts or bone builders. But when they are senescent or retired and quiet and non-active, everything goes haywire. The remodeling doesn't happen well. Cavati et al., a research team in 2023, further connected these dots. They explained how ages and oxidative stress in type 2 diabetics drive bone fragility, with implications for better fracture risk assessment. Insulin resistance doesn't just mess with your waistline, it silently also undermines your skeleton, turning minor impacts into major breaks potentially. So what can we do about it? There are many strategies, and we've hinted at some of those over the preceding episodes. Strategies to protect against glycation-induced bone issues boil down basically to controlling blood sugar, reducing the intake of exogenous ages, those are ages in our diet, and supporting bone health through lifestyle. First, prioritize metabolic health, and we can do this by adopting a low-carb diet to minimize glucose spikes and insulin resistance. In this case, you would imagine whole foods, proteins, and healthy fats over the highly processed carbohydrates. I'm not saying you need to shun every carbohydrate, but minimize the excursions so those spikes don't worsen glycation in your bones and joints. Another aspect we've covered in the past is regular exercise. Some people ask me on occasion what the best exercise is, and I always come back with this conclusion. Exercise, the best exercise, is any movement that you'll do. Exercise is crucial. You don't need some elaborate routine, just move frequently. Resistance training can build bone density and improve insulin sensitivity. So where appropriate, try some of that. Even walking helps clear glucose. That's been shown by many, especially first thing in the day when the sun's out. That can help clear glucose levels effectively. Now, there are also many types of supplements that can also inhibit age formation. Alpha lipoic acid is something that you might consider. Although evidence is still emerging, some supplements like that may help some of us. I would like to highly recommend that we avoid high age foods. This is excessively burnt or grilled meats and fried items. Now, you can have meat, and you should have meat, because that is one of the best sources for dietary proteins and fats. But it's the burned, charred ends that will be rich in ages. Some may opt for steaming or boiling these foods. For those with diabetes, tight glucose control is non-negotiable. So definitely adhere to diets where those excursions, the spikes in glucose, are minimized. Now, you shouldn't forget about vitamin D and vitamin K2 in bone mineralization. These aren't quick fixes, but there is some evidence-based ways to slow the progressive matrix loss and shield against bone wasting, hallmarks of osteoporosis and osteoarthritis. So let's wrap up. Glycation isn't just a side effect of poor metabolism, it is the means of providing a direct assault on your bones, linking aging, insulin resistance to diseases like osteoporosis and osteoarthritis. By understanding this connection or this relationship, we can empower ourselves to act. We would decide to more effectively keep blood sugar in check. We may decide to move our body frequently and eat smarter. Finally, as always, I'd like to encourage you to continue to stay curious. Keep learning about your metabolic health because knowledge can prepare you to better take care of your skeleton over the long term. Thanks, everyone, for joining me today. I'll see you next time. Stay sharp and stay healthy, and we'll talk to you again soon.